So when you were going to the doctor,
Mhm.
even, younger, were you thinking these were just razor bumps or?
Exactly. Because in my adolescence, shaving was a thing, right? So that's exactly what we thought it was, or what I thought it was. And even in the areas that I was getting it, I was told that it could be chafing or irritation, but not HS. HS didn't come up until 2019.
Wow.
Yeah.
So you get a little older, you start having kids in your 20s and you start getting more clusters and more pain.
Yes.
So when you first went to the doctor, what was their original diagnosis? Were they still saying razor bumps? Like what were they thinking it was at first?
Cyst or just a boil. I remember even before I had my daughter, my primary care doctor just thought it was a cyst in my chest area, and we drained it. A breast surgeon actually drained it, but HS didn't come on the platform for me, at least at that time. That was way before I was diagnosed. That was in 2007.
Mm.
So that it was just a cyst or cyst.
And so when they were treating it like it was just a cyst, was it still happening kind of spread far apart just
Yes,
every once in a
every
while?
once in a while.
And you talked a little bit about drainage. Were they giving you other kind of remedies or treatments or things like that? Were they recommending anything like hot compress? Were they giving you
Not at that
antibiotics?
time. It was more so a topical when it would burst, and that was it. Your skin would heal itself, which it did. Everything that they said would happen would happen. But the more painful or the more drainage or even the more tunneling, I did not start to see until later on.
Mm.
If a boil or a cyst came, it would rear its ugly head, it would burst, it would be gone for sometimes a year and a half. I wouldn't see anything.
And did you notice anything just as far as the time periods that these would come on? I know sometimes depending on
Mhm.
hormone
Yes,
fluctuations, you talk about when you start having kids. And
yes,
so were you noticing that
yes.
pattern at all or?
At first I didn't, until I started to see a nutritionist, and my nutritionist told me to pay attention to my time of the month. And that's when I started to realize that the flare-ups now were happening. And that's when I started to pay attention. I started to reading more about HS, and this was before my diagnosis, actually. And that's kind of what geared me towards seeing my primary care doctor first, and she brought up HS. And that's kind of how my diagnosis came about. But yes, my cycle is what kind of was the flag for me.